One of the stories that we're going to be talking about with her, the fact that, let's face it, millions of us are likely to develop and die from heart disease, live in cardiology deserts. And what is that? What is a cardiology desert? It's areas of the United States without a single heart specialist to care for them. This is a big story that if you live in, say, rural Main Street, USA, wherever it may be, there may not be a cardiologist around you for miles. And new research out on Monday in the Journal of the American College of Cardiology finds that nearly half of all counties in the United States are lacking a practicing cardiologist. Nearly half of all counties in the U.S. don't have a practicing cardiologist anywhere nearby. And most of these counties are rural, where residents who tend to be sicker in general with very complex medical problems. Dr. Farah is going to be coming up, and I wanted to get her thoughts on that because you're looking at a situation that counties that do not have cardiologists probably need this type of specialty care even more. And I believe we've got Dr. Farah on the line with us, and it's nice to have you back on radio. I think I heard you in the background. Welcome back.
Thank you for having me. It's always great to be on your show.
Absolutely. Thank you. We were just telling the audience that most important top priority is patients, and you're just now getting out of surgery. So thank you very much for joining me on the program to talk about all this. And this story that came out, that these numbers are really quite staggering, that millions of Americans likely to develop and die from heart disease live in cardiology deserts, parts of the U.S. without a single heart specialist to care for them. That's got to be alarming, Doctor. What do you think?
Oh, absolutely. There are, as you mentioned, large parts of the country where, especially in rural areas, we lack access to medical care, particularly cardiology care. And it's scary because that's the #1 killer for both men and women in our country. So that is one area that we definitely need to work on as a society.
When you look at where this data was published in the Journal of the American College of Cardiology, that is the gold standard, correct in that? And they were mentioning nearly half of all the counties in the U.S. lack a practicing cardiologist. And I'm thinking, Doctor, that maybe the closest one could be 30 miles away, 40, or maybe 50 miles away, right? Or maybe more before one can find a cardiologist.
Exactly. In some rural areas, it could be more than that. And it's a real problem because, not just for chronic care, but also for acute care. There are areas where if somebody's having a heart attack, they don't have the facilities where they can get the standard of care that we typically provide in urban areas, so to speak. So sometimes, what I'm getting at with that is, in the setting of an acute heart attack, what we like to do is do a surgery. We like to get in there and see where the blockage is and put a stent in there and open up that blockage. In rural areas where they don't have a proper cath lab, that's where we do these procedures, what they do is they won't be able to do these procedures in a timely manner, so they instead inject a medicine that's it's called a lytic, so to speak. It breaks down that clot. So that's not the ideal therapy. So they will provide that in the initial setting, and then they will send the patient then, like either by helicopter or ambulance, to the nearest cath lab, which could be an hour or 2 hours away. And
wow.
So, yes, that is a problem.
Yeah, and time is really of the essence with that, correct in that? The quicker you get somebody in, the better chance for survival?
It is. When it comes to heart, time is life. The quicker we fix that blockage in the setting of a heart attack, the higher the survival of rate of survival, and also the higher the rate of survival without complications.
Well, and this also, I think, maybe brings us up another point, right, Doctor, that those counties, since they're so rural, that many of the residents there may tend to be sicker in general with complex medical situations or problems going on. Is that accurate?
That is very accurate. In areas where they don't have access to cardiology care, they usually lack access to other types of care as well, primary care, for instance. And so they just have chronic conditions that go undiagnosed, for example, high blood pressure, diabetes, that they don't get regular care for, and these are the biggest risk factors for having heart disease. And so by the time these guys actually get any kind of medical care, they're already very far into whatever it is that they have, especially when it comes to heart disease. They may have significant blockages that could have been prevented had they had that access to medical care on time.
Yeah, and being in the specialized area that you're in, that requires so many more additional years of training. Correct in that, to get into that kind of a specialty out there, and that trying to maybe fill that gap for those rural areas sounds like it would take a lot of time to maybe get folks in there and start practicing cardiology. We're talking about a big time lag in your estimation?
Yes, it takes many, many years to become a certified cardiologist. It takes, it takes roughly 14 years. That's a long period of time to give up to become a certified cardiologist to where you can practice on your own. And so, yes, that can create that lag time. So we definitely need more people to be interested in this field and go in and dedicate that kind of time. It takes a lot of sacrifice from an individual to want to give up that kind of time to get into a specialty like that to be able to serve their community.
Now, one might think, doctor, that maybe if somebody was a physician assistant, a PA, that might be a quick way to maybe fill that void, or is that maybe within the time frame we were mentioning would take many years to get somebody with a PA behind their name to get them in there as well? So would that maybe make a difference?
It does take quite some time to become a physician's assistant or a nurse practitioner. However, they're great tools. They're a great asset to our medical care as part of our team. They can help in a cardiology clinic in very straightforward things, like, for example, a simple blood pressure check where the decisions have already been made by the cardiologist from before, and they're just checking up to make sure this patient is taking their medications. So simple things like that, yes, we can use PAs and nurse practitioners in the field of cardiology, and they're great help to us, and they can increase that access to care in that way. However, in no way can they replace a cardiologist because they simply don't have the training nor the knowledge base to be able to provide complete cardiac care without a cardiologist. So,
I would imagine.
It's a tough, yeah.
I was going to say, doctor, I mean, it sounds like this may be a situation where communities need to get together and form maybe coalitions or groups to offer input, find ways to do this. Is this going to be done, in your estimation, maybe community-wide basis, region, county to county, in order to try to alleviate this? I can't imagine maybe a small rural city or town maybe being able to handle this on their own to get somebody in. How do you explain it?
You're right. It is a problem, and it is something, I will say it's something, of course, we need to work as a team, as a society to get, better at it. I will say since COVID, this access to medical care has improved a little bit just because of telemedicine. People who are hundreds of miles away and they don't have access to a cardiologist in their town, now we can provide that via telemedicine. Of course, that person is not in front of us, but through video teleconferencing, we can do a lot for that person until they are able to come to the place physically. So at least through medications and things like that, I will say that we're doing much better with telemedicine in terms of that particular problem of access to medicine.
All right, doctor, we're going to break for the commercials. And ladies and gentlemen, did you know that if you live in a rural area, think, maybe I'm just going to use an example like Mayberry. Think of it in those terms, a small community that may not have the kind of medical care that you need, small town America, in other words, that millions of Americans likely to develop and die from heart disease live in cardiology deserts. These are areas of the country without a single heart specialist to care for them. We're going to go into all of that a little bit more So stay tuned. We got a bunch more coming up for you. I'm Mark Willis on SiriusXM 146.
We now return to Mark Willis and Road Dog Trucking News on SiriusXM's Road Dog Trucking Radio.
Drivers, here I want to welcome you back, and, it's nice to have you on board, wherever you may be. And this cardiology desert we've been describing here with Dr. Fahmi Farah, who's on. The story basically is millions of us likely to develop and die from heart disease. Live in cardiology deserts, areas of the United States without a single heart specialist to care for them. And I think they've made a number of movies, Hallmark movies, about, the efforts of the local community to try to get a doctor to relocate to these communities. Always had a heartwarming ending. And the other side of the story, though, the reality is that it's a real problem with getting folks into, like, rural communities to practice medicine, cardiology, a whole bunch of other things. And Dr. Fahmi Farah is on board with us, one of North America's leading cardiologists. And, Doctor, thank you very much. Where can folks find you on the web, by the way? Social media and all the above. Where can they go?
You can find me at www.drfahmifarah.com, also at Fahmi J. Farah on X and Instagram.
Okay, very good. Thanks so much for doing this. And I would think that, people that are living in these counties, that they're going to have a much more difficult challenge with cardiovascular risk factors. Smoking, high cholesterol, blood pressure, diabetes, you name it. Is that accurate?
That is correct, yes. All those are big risk factors for cardiovascular diseases.
Okay. And a treatment plan is going to be an essential part of that, correct? Because once you say that there's been a cardiovascular intervention by a physician, that's going to mean requirements for follow-up care, follow-up treatment. A colleague of mine had a mild heart attack about 2 to 3 weeks ago. And he's undergone a tremendous amount. He's had a couple stents put in, had a case of pneumonia, got released from the hospital, had to go back in due to a double pneumonia that he's going through right now. So there's got to be a support system in place. In other words, that say a cardiologist is able to intervene in some of these cardiology deserts, the entire support system has got to be there to support that patient. This could be the general practitioner, could be a number of other things, right? Part of the whole package that rural America needs to see, more medical care. What are your thoughts?
I totally agree with you. Yes, typically when we, diagnose somebody with heart disease or somebody who has a heart attack, regardless of whether it's mild or a massive heart attack, there is follow-up care that's required. And part of that follow-up care, of course, is continuous treatment for that. And a large portion of it is also prevention, to make sure that another heart attack doesn't happen, making sure the patient is compliant with the treatment plan that we've provided and the prescriptions. And also risk factor management, which would mean making sure their high blood pressure, high cholesterol, diabetes are all under check. And if they have any unhealthy habits such as smoking, drinking, that we're continuously guiding them and counseling them to stop those.
Yeah, and this is also come into play, Doctor, as far as like other areas that need to be looked at as well, like maybe somebody that is in one of the rural community settings you're describing, that they may not have access to healthy food, that maybe their situation is in such a setting that they can't afford maybe to go to the grocery store, things like that. Less access, in other words, to some of the basics that we take advantage of with good health. What do you think?
That's a huge problem. Unfortunately, in America, eating healthy can be costly sometimes. Cost has gone up, and it is a problem in many, many communities in the United States. And we definitely need to work together as a whole at government levels and nationally and locally to provide better access to healthier foods. I think fast food culture is definitely detrimental. I think most people find it easier and cheaper to just go get something from McDonald's, or, I'm not trying to See, bad things about McDonald's, it's all fast food that's not good for you, and it's just so easily available and cheap, and that's not helping.
Doctor, I appreciate the time, and I know you just got out of surgery, and it's probably very exhausting, to say the very least, and I appreciate you sharing a few minutes with us, and I know you probably have got to go back and check on things, and all the best to you. Let's get all of the social media, website, even the phone numbers. Where can folks find you at Bentley Heart? Where can they go?
Of course. It's always a pleasure to be on your show. So, regardless of how many surgeries, I always enjoy this. So you can find me at www.drfahmifarah.com. Also on Instagram and X at Fahmi J. Farah. You can find me at Bentley Heart. Our phone number is 817-720-5185.
Okay, outstanding, Doctor. Thank you very much for joining me on the program. We're going to do it again, and that's Dr. Fahmi Farah on the line with us just out of surgery.